Got it.
Hi, my name is, I want to turn this off. Hold on. Hi, my name is Donna McDonald from the Institute of Gerontology at Wayne State University, and I'd like to welcome you to a series of educational videos created to help you on your journey in caregiving, whether as a professional or home-based. These videos were made possible by a grant called Functional Aging and Mindfulness for Seniors. This session is on Alzheimer's disease and dementia care. Please welcome Dana Rizzo.
Hi, everybody. Good afternoon. Today, we will be discussing Alzheimer's and dementia care. And I've been a registered nurse for over 35 years, and I have seen so much progress in this area. So I'm excited to share it with you. Now, let's just review a little bit about the normal brain. We have the frontal lobe, which is behind your forehead, and then we have the parietal lobe, which is located on the top of your head. We have the occipital lobe, which is located to the back of your head, and then we have the temporal lobe, which is right underneath your ears. And then we have the little cerebellum, which is called the little brain, that has a lot to do with our balance and coordination. And again, here we have the frontal lobe, temporal lobe, parietal lobe, occipital lobe, and the cerebellum, which is the little brain. Now, the interesting thing about Alzheimer's disease is that each of these sections of the brain control a certain part of your body. It has to do with language, understanding, creating words. Other parts could be dealing with organization, formulating numbers. Occipital lobe has a lot to do with balance, coordination, walking. Temporal lobe has a lot to do with hearing and understanding what you hear and emotions. And so when we talk about Alzheimer's disease, we can actually start to see which part of the brain that the disease is affecting. The human brain is an amazing organ. It's responsible for complex thoughts and memories and personality. The brain is the control center for movement and basic bodily functions, such as breathing, heart rate, and body temperatures. That's that little cerebellum at the base of your brain. And it processes input from the five senses, such as vision, hearing, smell, touch, and taste. All of these are interconnected by a network of nerve cells called neurons. And we each have over 100 billion neurons in our brains. And they're clustered together in various brain regions, such as the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. To understand Alzheimer's disease, it really helps to review how the brain works, how it is damaged by the Alzheimer's disease, and how this creates problems with memory, intellectual abilities, emotions, and behaviors. And there is a wonderful interactive tour of the brain through the alzheimers.org/brain, and it's called Inside the Brain, and it's an interactive tour that to learn how Alzheimer's affects the brain and its functions, and it lasts for just about 5 minutes, and it's free of charge, but I encourage you to seek out that resource. Now, the brain regions affected by Alzheimer's disease, they call this entire part of the brain the cerebrum. And this is the cerebellum, the little brain, and then the brain stem. But this whole section is the cerebrum. Neurologists conceive that that the human brain as having 3 different systems, which are connected by an extensive two-way network of neurons. Neurons are those nerve cells. The most basic system consists of the brain stem, which is here, the cerebellum, which is here, the little brain, and then the whole cerebrum. The control functions of survival, such as heartbeat and body temperature, are controlled through the brain stem and the cerebellum. The brain stem and the cerebellum are not affected by Alzheimer's disease until very late in its course. And that's when you start seeing motor functions such as walking, swallowing, and coordination, and basic movement becoming impaired. So that's when you know that it's towards the end and you've got the cerebellum being impaired. The other two systems, the limbic system, regarded as the emotional system, and the cerebral cortex, which is all of this, governs conscious thought. And both of them are affected much earlier in the course of Alzheimer's disease. So Alzheimer's disease often affects the limbic system, which has to do with emotions, and the cerebral cortex, which is all of this. The limbic system is located deep within the brain, and the limbic system is a complex center of nerves which link emotion and behavior. And stimulating one area produces feelings of anger and aggression, while stimulating another area creates feelings of pleasure and relaxation. The limbic system is the interface between our animal drives and the constraints of civilization, what's right and wrong, between irrational impulses and practical decisions, between raw emotions and rational behavior. And this was pointed out by Harvard Health. The limbic system also has another major function. It is central to memory and learning. Our memories are not stored in one location of our brain, but the limbic system kind of orchestrates memory formation and kind of sets up little file cabinets in all different parts of our brain to store memories. The hippocampus helps convert new information into long-term memory, and it assists with memory recall. And this is attacked early in Alzheimer's disease. That's why people with Alzheimer's disease have difficulty learning new information, and they also have difficulty with memory recall. The cerebral cortex, which is right here, is the region of conscious thought. We store memory and language skills, we process information, and we carry out creative thinking. As Alzheimer's disease worsens, areas of the cerebral cortex seem to shrink and become dysfunctional. This leads to problems with language, calculations, reasoning, and processing of visual information. The behavioral changes that we begin to see are things like forgetfulness, agitation, wandering and getting lost, losing important objects like keys and pacing. These changes are due to cerebral cortex changes in the brain. Now, all of us, I don't want you to get frightened, all of us have a little bit of forgetfulness. We all have agitation. We have a little bit of anxiety. Some of us can get lost in shopping centers. That would be me. Or temporarily losing important objects like misplacing our keys. The physicians don't get worried until when you report, oh, I keep losing my keys. The doctor will not be concerned about that. The doctor's going to be concerned when you say, or your spouse says, my husband put the keys in the freezer, or my husband put the keys in the washing machine. There you have correlation issues, and that signals a bigger problem. Now, again, here is the frontal lobe of the brain, which is the forehead, right behind the forehead. That has to do with attention, planning, decision-making. Alzheimer's starts to affect this early on. You have the parietal region, which has to do with movement and touch. You have the occipital, which has to do with vision. You have the cerebellum, which has to do with movement, coordination. The brain stem, which has to do with heart rate, swallowing, breathing, and temperature. The temporal region, right behind your ears, has to do with memory, processing, and emotions. Okay. So these neurotransmitters are just amazing things. The brain is a web of interconnecting nerve cells called neurons. This is a neuron. The human brain contains about 100 billion neurons. These neurons communicate with each other through chemical neurotransmitters. So here's one neuron communicating with this neuron, and right where they intersect, right here, there's all these little you see these little dots, these are called neurotransmitters, and these chemicals help to transfer that knowledge from one neuron to the other neuron, okay? And these neurons communicate with each other using chemical neurotransmitters, which generate signals that are passed on to one neuron to the other neuron. But in people with Alzheimer's disease, they have a very low level of a number of neurotransmitters. They're just not making neurotransmitters here, such as acetylcholine, which is one of the very, very important neurotransmitters. Neurons that produce acetylcholine are abundant in the forebrain, which is the forehead, and each has a long axon. See that long axon, long tail, to help it to communicate with other neurons throughout the brain, such as the cortex, which is needed for memory and learning. So without the acetylcholine and these other neurotransmitters in Alzheimer's, you can see where the information is going to become trapped or very slow to recall when it's trapped in one neuron and it's not being transferred to the next neuron. And this is where the neurotransmitters come in. Again, this is an actual MRI and showing you the billions of neurons that we have. Here is a neuron, and here's a long tail, the axon. And where you see these yellow lights, that's where one axon is connecting with the other neuron, and there's a release of neurotransmitters that is allowing the transfer of information in your brain. Okay. Now, plaques and tangles, we've all heard about these. The impairments in memory and thinking of Alzheimer's disease are linked to the production of two detrimental features in the brain. One is called an amyloid plaque, and the other is called neurofibrillary tangles. As plaques and tangles form, the neurons die, and the connections between the neurons are lost, and the brain actually begins to shrink in size. By the time someone with Alzheimer's disease dies, the cortex, which is the brain, may have already lost 90% of its acetylcholine, which is its main neurotransmitter for sending information from one neuron to the other neuron. Most medications approved to treat Alzheimer's boost the amount of acetylcholine available for brain function. So it boosts the release of acetylcholine. Scientists believe that the amyloid plaques begin to form up to 20 years or more before any memory or thinking problems are even noticed. Other damage in brains may also contribute to Alzheimer's. For example, if you have damage in blood vessels, such as vascular dementia, if you've had atherosclerotic plaques that have attacked your blood vessels and your arteries in your brain, that leads to a diminished blood flow to the brain, and it's called vascular. And it can lead to vascular dementia, which can also lead to Alzheimer's. Risk factors for Alzheimer's disease that cannot be controlled is age. As we rise steadily after the age of 65, we run a greater risk for Alzheimer's. Gender. Women have higher rates of Alzheimer's than men. 2 out of 3 cases due to women's longevity. Women still live about 7 years longer than men. Women with the APOE4, which is a protein variant gene, have a higher risk than men who carry the same gene. Family history. Having a first-degree relative with Alzheimer's doubles your risk. So if your mom or dad had Alzheimer's, that doubles your risk for Alzheimer's. I have a dear friend who just found out that she's 40, but her mother has the early onset Alzheimer's, and her mother is around 65. So my dear friend is quite worried. If you live to be 80 years old, you have about a 10 to 12% lifetime risk of developing Alzheimer's. And that's amazing because most of us are living well into our 80s. But when I work in senior living environment, and I see people in their 80s and 90s all the time that are as sharp today as they ever were. And that's because they have a healthy lifestyle, and we'll talk about that. Plaques and tangles. In the normal brain, you have your neuron and you have your axons. here where they're connecting and you've got your neurotransmitters being released and everything is fine. But in the Alzheimer's brain, you have these amyloid plaques and you have these neurofibrillary tangles. See these little red blood vessels that you can see are all tangled up around the axon of the nerve. And those are neurofibrillary tangles and the amyloid plaques. And these actually kill the neurons in the brain. And these protein plaques, amyloid plaques, are very bad. And here is an actual amyloid plaque with the neurofibrillary fibers. And you can see all of that and how it's killing that neuron. These are other neurons that are healthy in the brain that don't have that. Genes that cause Alzheimer's disease are having there are 3 known gene mutations that can cause early onset Alzheimer's. Preselin 1, Preselin 2, and all amyloid precursor protein, APP. And these genetic mutations increase the production of the plaques. Early onset Alzheimer's disease, age 45 years old, onset or younger, only accounts for 1% of total Alzheimer's in the United States. 50% of these, 50,000 of these cases in the United States, or 5.7 million people, have early onset Alzheimer's, which is around the age of 45 or younger. If you have the APOE gene, it comes in those 3 variants of alleles called E2, E3, E4, and E4 is the most problematic. So if you're getting a diagnosis of Alzheimer's, you want to go to an Alzheimer's specialist, a neurologist that can really pinpoint what is the gene mutation so that you're able to discuss it with your family. Factors you can control that can predispose you to Alzheimer's and dementia would be high blood pressure, because high blood pressure damages the blood vessels everywhere in your body, your arteries in your brain, arteries on your heart, and it can lead to vascular dementia in the brain. High cholesterol, those fatty plaques can form in the arteries of the brain, on the heart, leading to Alzheimer's. Obesity, having a lot of belly fat, having a big girth, can lead to strokes, diabetes mellitus, myocardial infarction or heart attack, and Alzheimer's. The metabolic syndrome, which is traditionally a syndrome where you have 3 symptoms or more. You have a large waistline, you have an elevated blood pressure, and you have high triglycerides and low HDLs. And these people with metabolic syndrome have difficulty regulating blood sugar. And when 3 or more of these factors are present, the doctors will call it a metabolic syndrome, which means you're heading for trouble, like diabetes and high blood pressure and obesity. Diabetes type 1 and type 2 can lead to vascular dementia and Alzheimer's, because diabetes affects not only the nerves, but also the blood vessels, and atherosclerotic plaque formation is increased. Smoking. Older smokers have an 80% chance of Alzheimer's. Older smokers. And I can tell you, working in senior living, most of the people that I work with that are in their 80s and 90s were smokers at one time, but they stopped smoking when they were in their 40s or 50s. And here they are in their 80s and they're still walking and going to water aerobics, and they're still exercising every day, and they keep their body weight down, and they never smoked again. And these people are sharp, they are alert and oriented ×3, they have lots of social engagement, and they're very, very happy in their older years. A head injury or a traumatic brain injury can cause encephalopathy of the brain, which is damage to the brain. And you see this a lot, this chronic traumatic encephalopathy with football players, boxers, combat veterans. And of course, depression. In midlife, depression can raise your stress hormones, which can damage your brain And this is a theory that's still being developed today. Possible protective factors. They're still doing a lot of research on Alzheimer's, but just seeing what I've seen in the course of my career, the more you exercise, the healthier you are. And it reduces your risk of Alzheimer's, diabetes type 2. Exercise reduces your risk of colon cancer, breast cancer, anxiety, depression, insomnia. Healthy diets. A healthy diet means you have heart health. If you have heart health, you have brain health. And staying on the Mediterranean diet or even the Mind diet or the DASH diet will help you. Watching your weight and waistline. This is one of the difficult things. Remember, every age, starting in really in your 30s, 1 to 2 pounds a year is kind of expected because our metabolic rates slow down, but not the tremendous weight gains that you see in Americans. You want to sleep at least 7 to 8 hours a night. And the doctors know that we get up 2 to 3 times a night to go to the bathroom, to urinate, but you still are able to get back into bed, fall soundly asleep. So 7 to 8 hours of sleep a night is expected. Getting up 2 times a night is expected. If you're getting up 4, 5, and 6 times a night, talk with your doctor about the type of diuretic you're on, the antihypertensive drug you're on, etc. Education. The more years of education you have, it's linked to lower Alzheimer's rates. And the onset of worse symptoms from Alzheimer's disease appears much later in life for people with higher education. And that's pretty darn amazing in that we had a gentleman that was 90 and he died, and they did an autopsy to find out what was the cause of death. And they found out that he had thrown a blood clot and that had killed him. The blood clot went into his heart and killed him. But they were absolutely amazed that this man who had a PhD, had a few master's degrees, he's always worked, he always lectured, and he was very active mentally, had advanced Alzheimer's. Nobody knew it because the onset of the Alzheimer's symptoms were so delayed because of his higher education. Mental stimulation, reading every day, writing, doing crossword puzzles, playing board games, strategy games like Monopoly or bingo. All of those things help keep mental stimulation going. Group discussions, playing music and listening to different kinds of music and card games such as poker really help you. My seniors play every afternoon starting around 3 o'clock. We have a card room and we have 4 card tables, and each card table seats about 5 to 6 people. And those card tables are full as these people play poker, Texas Hold'em, etc. Excuse me. The Mediterranean diet is a diet low in saturated fat from meat and dairy and high in monounsaturated and polyunsaturated fats, such as olive oil, canola oil, nuts, and fish. The Mediterranean diet contains vegetables and fruits and whole grains, beans for protein, high omega-3 fatty fishes, such as salmon, mackerel, and sardines, and even tuna fish. The Mind diet, it has the 10 healthy food groups in it and how often they should be eaten. The Mind diet and the Mediterranean diet are very similar. The Mind diet breaks it down into telling you exactly what are the portions per day. For instance, you should have green leafy vegetables every day. So eat a salad a day, keeps the doctor away. Eat other vegetables every day. What I do is I put diced peppers, I dice up cucumbers, mushrooms, and different fruits, blueberries or raspberries, and I throw them into a salad every day, avocado. You should have nuts and berries 2 to 3 times per week, but they want you to count the nuts, like 10 almonds is a serving size. Beans every other day, such as, you can make a white turkey chili that is fabulous. And Whole grains, 3 servings a day, and they actually are selling pastas. I have an Italian American background, so I buy the whole grain pastas and we'll eat that maybe once a week. Fish at least once per week, and that's super important. Poultry 2 or more times per week, either turkey or chicken. Olive oil, 1 serving each day, and that's about a tablespoon. Wine, you're allowed 1 glass a day or less, and that's a 4-ounce glass of wine, red wine. So the Mediterranean and the Mind diet, you can see that there is a real assortment of different colored fruits and vegetables, celery, broccoli, cremini mushrooms, which are the white mushrooms, sardines, salmon, etc., peppers, tomatoes. Every different colored fruit brings a different nutrient to your diet. You want to, in diagnosing Alzheimer's, you really want to find a doctor that is experienced at diagnosing Alzheimer's disease. A neurologist is key to this. The basic diagnostic tests that they'll offer are the personal medical history. Your neurologist will sit there with you for that. Physical and neurological exams where they're checking your reflexes, coordination, muscle tone, and strength. They're looking at eye movement to see if it's coordinated. They're looking at speech and sensation. Do you feel something hot? Do you feel a pinprick, etc.? Diagnostic tests, they'll do brain scans, MRIs, and CT scans. Neuropsychological testing, there will be some written tests, computer tests, and interviews. They'll even do a functional assessment. You know, what can a person do and not do for their activities of daily living? A lot of times they'll bring in their spouse and the wife says, you know, my husband can't put on his shoes anymore. Or the husband will say, my wife is having trouble buttoning her clothes or remembering that how to attach her bra. And they'll often do an electroencephalogram, EEG, and they'll even do a lumbar puncture to try to rule out other things. Some more advanced tests that they run for Alzheimer's diagnosis are the amyloid PET scans, and they're looking for the amyloid plaques in the living brain. Cost is around $6,000, and insurance will help pay for part of that. They have the tau PET scans, and that's where they're looking for the tau neurofibrillary tangles, those little red tangles that are occurring around the axon in the living brain. They'll run genetic tests like the APOE4 gene, looking for that gene. And then they'll do a psychological evaluation by a social worker for planning ahead. Reversible causes of dementia. Dementia can be a temporary thing where it can be related to a reaction to drugs. That's why a lot of times on a pill label, the prescription label, it'll say, use with caution if over 65. There's a lot of drugs such as anti-anxiety drugs, antihistamines like Benadryl, anti-seizure drugs, opioids, and some cardiovascular drugs that can cause a lot of confusion. Depression can cause confusion. Vitamin B12 deficiency. Now, B12 we often find in eggs, poultry, fish, dairy, and meat. And there is a B12 deficiency that can cause pernicious anemia, and pernicious anemia can change your personality. We actually had a resident that has chronic pernicious anemia, and she has to go for vitamin B12 infusions. And if she ever misses those infusions, you know right away, because she becomes very confused. Hydrocephalus is reversible, but it's water on the brain, and that can be reversed. Tumors depends on the brain's tumor of the location in the brain, but the symptoms can vary. Subdural hematomas, which is pooling of blood outside a blood vessel in the brain, that can be resolved, and it can cause temporary Alzheimer's or dementia. Thyroid disease, an overproduction or underproduction of thyroid hormones. It's treatable, But it any kind of thyroid, hypothyroidism or hyperthyroidism, it can be reversed, but sometimes the symptoms of dementia don't go away. Alcoholism is a chronic B12 deficiency, which can really destroy brain cells. It can lead to forgetfulness, clumsiness, impaired memory, orientation, and attention decline. Autoimmune diseases such as MS, multiple sclerosis, or systemic lupus erythematosus, limbic encephalitis, Hashimoto's encephalitis, and sarcoidosis can all lead to a sense of dementia and affect your cognition, but it is reversible. HIV is often associated with cognitive impairment and dementia. But if it's untreated, it can lead to the dementia. But if it is treated, we can really reduce some of those symptoms. If these are irreversible causes of dementia, which lead to Alzheimer's, if you have damage to your blood vessels, vascular dementia, we can't reverse it. If you have Lewy body disease, where you have abnormal clumps of protein inside the neuron, it's called Lewy body. We cannot reverse that. Parkinson's disease. These are Lewy bodies that accumulate in the brain that control movement. And using, usually it's the tegmental area of the midbrain. So it's affecting your movement centers and coordination. Frontotemporal dementia. FTD, and this is Pick's disease, and it's shrinkage of just the frontal and temporal lobes of the brain, and it affects reasoning, decision-making, language, personality, and social behavior. And it's very difficult to control people's behaviors when they have frontotemporal dementia, FTD. Huntington's disease is a very rare inherited abnormal gene, but it appears in 20 to 40-year-olds. They have the Creutzfeldt-Jakob disease, which is an inherited, it's a normal protein that is converted to an abnormal protein called prion. And normally these people die within a year of diagnosis. There's this condition called neurosyphilis. And I saw this over 40 years ago with people that had syphilis and they didn't get it treated. And that was before penicillin, or people just refused to get the antibiotic. They refused to go to the clinic and take the antibiotic. And up to 30% of these people with neurosyphilis developed and were admitted to mental institutions with neurosyphilis. And it begins about 15 years after the initial syphilis infection. And the patients that I had been working with were in their 60s, and they had syphilis in their 30s and 40s, never had it adequately treated, and developed dementia. They use a lot of different combinations of drugs to treat dementia. So your doctors are your experts on this. To relieve, we can't cure Alzheimer's yet, but we try to relieve the symptoms of Alzheimer's, such as we try to boost the acetylcholine, the neurotransmitter production. The first classification of drugs approved by the FDA work by reducing cholinesterase, thus preventing the breakdown of acetylcholine. So this drug classification of drug actually produces more acetylcholine. And the first one is called Aricept. That's been around a long time. It's most widely used, and it prevents the breakdown of acetylcholine. And it works very, very well, and it helps the chemical messenger in the brain to work better. Exelon is another one, and also Razodine. And I've seen all three of these and have administered all three of these in my practice as a nurse. Second classification of drugs are called the NMDA, Namenda antagonist. And it's used for moderate to severe Alzheimer's dementia, and it works by preventing glutamate, which is another neurotransmitter, from attaching to the NMDA receptors in the brain. because if there's excessive amounts of glutamate, it is made by the brain, it will destroy brain cells. And this was approved by the FDA, Dementia, back in 2003. And a lot of doctors will prescribe combinations. The third big classification of drug is a combination of drug that is a cholinesterase inhibitor, thus increasing acetylcholine, which is the good neurotransmitter, and it regulates how much glutamate is made so that it will not damage blood neurons in the brain. And this drug is donzepel and Namzarek combined, and that was approved by the FDA in 2014, and that's to treat moderate to severe stages of Alzheimer's disease. They use medications for behavior problems such as antidepressants, which will help with moodiness and sleep disturbances. They use antipsychotics to help to reduce hallucinations, moodiness, and agitation. These hallucinations can be quite frightening to them. They use anti-anxiety drugs, which help with anxiety, insomnia, pacing, and fearfulness as well. So you'll see all of these classifications of drugs being given. They give the antidepressants, and there's different kinds of antidepressants that are used, and your doctor will be the best and pharmacist, the best person for that. They use these mood stabilizing drugs as well to really help to stimulate the mood, decrease anxiety, depression, and fearfulness. And they're very, very helpful in a therapeutic dose. Sometimes people with Alzheimer's have abnormal nerve pain. So they give a drug called gabapentin, which is effective for nerve pain. They give this a lot with diabetics that have peripheral neuropathy as well. Therapies under investigation are that they're looking at drugs that will reduce beta amyloid plaques. It'll either reduce the production of beta amyloid, or it'll help the brain to clear it and to break it down and discard it. They're actually looking at medications that enhance the clearance of beta amyloid plaques, and also drugs that are targeting the neurofibrillary tangles, which form inside of the neurons. You saw that in a picture. They're also looking at MRIs for electrical brain stimulation. They're also looking at implanting healthy neurons into the brain of the Alzheimer's patient to see if that's going to help. So all of these therapies are under investigation and being looked at right now. So the symptoms that occur usually tell the doctors and the neurologists where the Alzheimer's disease is, whether it's in the frontal lobe, the parietal lobe, the occipital lobe, or if it's going here into the temporal lobe. The five behaviors, we see a lot of behaviors, but the five causes of behavior changes are usually physical or physiological reasons. The individual with Alzheimer's could be feeling pain and not be able to express it, fatigue, discomfort. Due to their impaired speech, they cannot tell you what's wrong. They have very short attention spans, and they will forget that they've got a fractured hip, and they'll continue to walk on it when they shouldn't. They have other medical problems that also complicate the picture, and there could be complications and side effects from medications. For instance, if they're on a heart drug, that heart drug could be interfering with some of the Alzheimer's drugs. So the doctors have to do a true assessment of all medications, and so does the pharmacist. Their emotional health, because Alzheimer's patients often feel depression, they feel a loss of control. They can feel scared, tired, lonely. They can fear for their health and death. They have a fear of loss of identity, loss of family or spouse, and feelings of inadequacy. But remember, emotional health is greatly boosted by having caregivers like yourselves that are taking classes like this, that you can understand what's happening, and that it's not something that is on purpose. These are definite sections of the brain that have been affected by Alzheimer's. You want to look in the area of the environment. If you've got an Alzheimer's patient that is acting out, look at the environment. Is there sensory overload? Or is there just too many people, like around a holiday? Is there too much noise? Is there too much light? Is there music playing? Are people talking? And all of this is sensory overload. And it is something that startles the person with Alzheimer's and can lead to agitating behaviors in themselves. Look at the tasks that we've given the person with Alzheimer's. If they're acting out, look at ourselves. Are we overwhelmed? You know, a lot of us are in the sandwich generation where we've got kids that we're trying to get off to elementary school or high school, and then we have a parent who has Alzheimer's and we're having trouble getting them dressed. And yet we have this other kid that we have to worry about, our children that are forgetting their homework and their backpack, and they're forgetting to put on the right clothes for school and things like that. So look at yourself. Are you overwhelmed? Are you trying to rush them or overstimulate them? Are you making the task too complicated? If they cannot focus because of too much stimulation, remember they already suffer from poor attention, communication. If they're having difficulty understanding you, look at your form of verbal communication. Look at the words that you are using. Make sure that they're understandable, that your choices are to, Dad, do you want to wear this plaid shirt? Or Dad, do you want to wear this shirt? Two choices. Dad, I will help you put on your shoes while you buckle your belt. Okay, two choices. You want to also be aware of your nonverbal communication. Be aware of your own actions. Are you moving slowly? Or are you using jerky actions? Are you too fast? Is your body language telling them that you're frustrated? Your facial expressions, your tone of voice. You know, there's a difference between, Dad, what kind of shirt do you want? The plaid one or this one? Or for heaven's sakes, Dad, put on one of these shirts. That tone of voice makes all the difference. Be aware of how you're expressing your emotion, and be aware of the inflection of your voice and other nonverbal communication. And, you know, we're all human. We're all, we all are entitled to feeling our own fatigue and anxiety. And we're mourning the loss of a parent or a loved one, a husband or a wife, when they have Alzheimer's. So we ourselves need support groups. And that's why they have 3 shifts of nurses in the hospital, because even nurses, as tolerant as we are, we can only take really 8 hours. And then we have a new shift of nurses, and then 8 hours later, a 3rd shift of nurses, because all of us are entitled because we're humans. But I remember that I always remember to myself saying their IQ is the same, because my dad was extremely bright, but he had vascular dementia. And I'll never forget that. I had been working in ICU and CCU, and I'd come home and I was very tired. And I remember coming home and my son doesn't have his homework done. My husband is doing something on his computer and not helping out with the kids' homework. My daughter was upstairs not completing her homework, and my dad was visiting. And I remember my dad, the minute I came in, he had a list of things he wanted me to do. List. And I remember saying, I will get to that list when I check on the kids first. But it was my tone, it was my body language, and my dad's face crumbled. And I'll never forget that to this day, that I hugged him and I said, Dad, I'm so sorry. That was me. I'm very tired. I had a really rough day in ICU today. And I'm really sorry. And I'm going to get to that list of things you want me to do. But I needed to own it, you know, and I needed to take responsibility for my words. Now, the 3 stages of Alzheimer's, and it depends on the research that you have, but some researchers use 7 stages of Alzheimer's, others use 5. The Alzheimer's Association uses these 3. The early stage of Alzheimer's, people can function independently. They can still drive, dress themselves, they can work, and they can be part of everyday social activities. They still like going to yoga, and they like dance and swimming lessons, but they sometimes have problem finding words or names. It's a retrieval issue. Their IQ is always the same. They have trouble remembering names when introduced to new people. They have challenges with tasks at work or social tasks, just little trouble. They sometimes forget material that they just read. Sometimes they're losing or misplacing a valuable object, such as a key, a wedding ring, or medications. Sometimes they have trouble with planning and organizing. So one of the things you can do is create an action plan, and you can visit the different kinds of action plans available at the Alzheimer's navigation app. In the middle stage Alzheimer's, this is the longest stage, middle stage. It can last for many years, and they begin to require a greater level of care. They're forgetful of their personal history and events. You know, they may forget that they were a nurse, or they could forget that they were a cook or a teacher. They can feel moody, they withdraw, they can lack insight into their own behavior. A lot of times they're moody and feeling withdrawn because they can sense that they're losing vital information or a part of themselves, and they can't do anything about it. They cannot recall their address, phone number, high school, or their college. Again, you can visit the Alzheimer's.org organization and look for medical alert bracelets and different. The Alzheimer's Association has a safe return medical assistance program where the police and the EMTs and everybody in the neighborhood are aware that there's someone with Alzheimer's that sometimes wanders. They can have confusion about time and place. 6 out of 10 of them will wander and become lost. They cannot select appropriate clothes, so they need for the right season. So they need help with that. They have trouble controlling bladder and bowel in some people. They have changes in their sleep patterns. They confuse day and night. So they sleep all day and they're up all night. That doesn't go over too well in a family that has kids that have to get up in the morning to go to school. And they're very restless. They also have an increased risk of wandering and getting lost as stage 2 progresses. And we have to really focus on nutrition, because these people will often forget, people with Alzheimer's, they are going to forget to eat and to take the time to go to the bathroom. And it's important to offer them that. Say, hey, Mom, it's time to go to the bathroom. It's been a couple of hours. How about coming with me? And the same with Dad. Some behavioral and personality changes you see are that they begin getting more suspicious and they get delusional. They can get compulsive, and repetitive behaviors like wringing their hands or tearing tissue, shredding tissue, become something that they do. In the late stage of Alzheimer's, in the final stage of the disease, individuals lose the ability to respond to their environment. And that's because a greater part of their brain now is being affected by Alzheimer's. They cannot carry on conversations, and they eventually lose control of movement as the Alzheimer's progresses into the cerebellum and the occipital regions. And at this stage, they need 24/7 care with assistance with all activities of daily living and personal care. They can't even brush their teeth. They lose awareness of recent experiences as well as their surroundings. They experience changes in physical abilities. One day they might be able to walk from their bed to the chair nearby, but they wake up the next morning and they cannot walk. They cannot sit upright, and they start having swallowing difficulties in stage 3. A lot of them have a great deal of difficulty with communication, and speech becomes impaired. They have increased vulnerability to infections such as pneumonia, COVID, and influenza. And they have hazards of immobility because they stay in bed so long. You're going to see bed sores, pneumonia, constipation, incontinence and rashes from that. You'll get aspiration of food or liquids into the lungs because they can't swallow properly, that the food and liquids will go into their lungs. When communicating with a person with Alzheimer's or dementia, you want to try these techniques. You want to get low and speak slow, face the person and get to their level. And that might mean bending down and talking with them. You want to speak slowly. Use the person's name, and it's usually the first name that will register with them. Do not rush them. Wait for their response. Repeat the question if necessary, and make sure that it's a simple question. You want to give them cues or model behavior. For example, you may have to pick up a spoon and say, this spoon is for the soup, and model how they use the spoon to eat the soup. Okay. You want to make sure that you never have knives around. You want to smile at all times to them. Let them know that smiling is a way of accepting the person, and smiling is a way to uplift their soul and spirit. Praise and reassure the person. Dad, that was great. I like the plaid shirt that you picked out. That's great, Dad. Focus on the present and not the past when communicating with the person. Dad, tonight, what would you like to watch on TV? Okay. With stage 1 early dementia, you want to provide crafts that are simple to increase their self-esteem and their sense of accomplishment. Have a schedule to complete daily living skills to preserve dignity, such as a daily schedule. Okay, let's brush our hair first, then we'll shave, and then you brush your teeth. Provide daily physical exercise to help reduce their stress and their frustration and to elevate their mood. Remember, exercise promotes a better sleep pattern too. In the early stages, you want to enroll them in a sensory program to improve recognition. For example, programs that offer sensory include the use of sense, vision, hearing, tactile, and taste. At my senior center, they have a quilting club, and they use giant needles with big holes in them, so it's easy to thread the yarn, and they're attaching buttons to the quilts, or they're sewing patches on the quilt. And this has to do with scent, hearing, tactile, and taste. They have to feel and taste. A lot of times in the room, they'll have the ocean sounds in the background, or they might have slow music. They often have scents in the air like lavender or lemon. And also, financial and legal matters need to be taken care of in the early stages of dementia so that their decisions are known. In stage 2, middle dementia, the crafts and arts still have to be very simple, maybe only 1 to 2 steps, and you want to create success for them and increase their self-worth. In our Alzheimer's unit, they had a birdhouse craft, and the birdhouse craft came with 6 pieces. But in our Alzheimer's community, we actually put 4 of the pieces together, and they only had to put 2 pieces together to complete the birdhouse. And they loved it because we had some people that really liked woodworking. And you can buy those crafts at Lowe's and at Home Depot. They're about $5. Create and schedule daily activities of living. Like, okay, Dad, it's 10 o'clock. I know you like your cup of coffee at 10 o'clock. And let's get up at 9 o'clock then, so we can get you shaved and showered and your teeth brushed, and then you'll be ready for coffee at 10 a.m. Daily physical exercise is imperative because it gives them an outlet, so there's less wandering and pacing. Sensory programs, again, that help them to learn, and the retention of materials and old skills. Cooking, a lot of them enjoy cooking. So we will often make the cookie dough, and we will help them roll out the cookie dough and use the cookie cutters, and then they can smell the cookies as they're being baked, and then they help decorate them at the end. We want to provide nutritious finger foods. Remember, these people in stage 2 dementia are on the go. They're usually walking very quickly, they're pacing, and they don't stop long enough to sit down and have a meal. But you want finger foods like maybe chicken McNuggets or carrot sticks, celery sticks, apples cut up, things like that. You want to use doorknob devices that prevent them from opening the door, getting out to wander. A black rug in front of all doors gives them, remember, they're having visual changes also because the occipital region of the back of the brain is being affected. But for some reason, a black rug in the front of a door doesn't frighten them, but it makes them think that they can't walk over it and they'll stay away from the door. There's other things you can buy, door alarms and window alarms. There are some devices that you can order on Amazon where the door is they have an adhesive piece of paper that covers the entire door and it looks like a bookcase. So they look at that and they say, oh, that's not a door, that's a bookcase. And they don't go out there. They have window alarms that you can buy. These nutritious finger foods are there to replace calories that are lost with the constant pacing. In stage 3 late dementia, remember, they can no longer recall activities of daily living. They have short attention spans. They really need a lot of nurturing and support. They have difficulty swallowing and they're incontinent, and they have difficulty walking, and they're at huge fall risk. So you want to provide crafts and arts that have very few steps, provide soft music, preserve their dignity when providing all their care, bathing, dressing, and bathroom, provide daily physical exercises, even short walks or chair exercises. We do a lot of chair exercises where in our memory unit, they're all sitting in their chairs and there's a big ball and they bounce it back and forth to each other, which is getting them to move their upper body. And then they have lower leg exercises. They have a enclosed courtyard. So they walk in the enclosed courtyard with their caregiver 3 times a day. And it's always in the same direction so that they have that routine pattern. You want to provide sensory experiences for the person, such as their favorite smell or their favorite blanket. A lot of families will bring blankets home into the building so that they have their favorite blanket or their favorite little shrug on, or shirts. They love soft clothing. They like to work with buttons, just rubbing the buttons. So we have a fabric board, and on this fabric board, and you can easily make it, they have corduroy and they have velvet, and then they have nylon, and they have another one that's a nubby cotton, and then they have buttons throughout the fabric board. And you'll see them sitting there with this little fabric board all day as they watch TV or they're listening to the music, and they'll just rub their hands over it. So tips for caregivers: you want to get yourself organized, ask for help and accept it, offer support and accept support if you're the main caregiver, collect medical information and always have it in a file, obtain respite care. Medicare will pay for you to have 5 days of respite care, and they will bring in someone to stay with them so that you can get away for a vacation. You want to join a real-time or virtual care support group if you can't get away. You want to be able to blow off steam, be with an understanding friend or relative who understands that you're just blowing off steam, but it helps you. And try to take care of yourself. Remember, you do need a caregiver break. We've already talked about the special precautions for wanderers. General safety measures: make sure that you put all knives away, make sure that you have well-lit areas in your house, lower the temperature on your water heaters, make sure that someone had to remove all the knobs on her stove so that her mother wouldn't turn on the stove and then walk away from it. You want to put away all your firearms and power tools, put away all your sharp knives and scissors and machinery. You want to get organized, ask for Alzheimer's Connected, go to the Alzheimer's website. Legal and financial matters in the early stages, you want to make sure that you have a durable power of attorney. Make sure that if there's trusts set up, that there is a power of attorney, etc. Make sure you contact an attorney. Make sure that there's advanced directives, which in the healthcare power of attorney. Donna?
I know, honey.
Did I go off?
That fucking thing.
Did I go offline again? You want to remember durable power of attorney, which only covers your financial and legal matters. Advanced care planning has a lot to do with the process of what you want done. And I want to thank you all for being here today. Have a lovely day. Hi, Donna, we're all done.
You were talking about sharp knives.
Okay,
So
that was,
once I can get back on we just had a power surge. I don't know what's going on.
okay,
So I'm just gonna have you record just the last little sentence I think you did.
okay.
You were on that slide about, I can't even get back on yet.
It was the late stages, yeah. I know where I was.
Okay.
I just found it.
Here.
I just found it.
Let me see here. And then I can splice it together, but I gotta be able to get back on there, so hold on.
Okay.
Action needed, let me see what's going on. I don't know what happened that we all had a power surge. It wasn't on your end, it was mine this time. So,
Oh, boy.
like, okay,
Both Virginia and Michigan are having issues.
yeah, okay. Let me see if I can get in Zoom now. Connect. The next one up is the sleep one, just so you know.
Oh, yes.
All right, it's not letting me get on there. Tim, can you figure out why it's not letting me?
How does your husband feel too? Is he 100%?
Yep, everything is good with him.
Oh, good.
Except I'm gonna kill him if this doesn't start working.
I had the same thing with Charlie, and he just left. I just watched the car pull away. I'm thinking, oh, that's nice.
Well, these things we should be able to do, but I can't get it to come up. He said it's still generating. It's a router too.
Yeah.
All right. Well, once we, I want to stay on this meeting though and have it all together. That way, when they splice it together, it's all together. So that should be all right. I guess if you wanna pull up your sleep one and get it ready to go,
Okay.
can you do that from where you're at or no?
Yeah, no, I have to actually exit out of this completely.
Oh, it takes that. No, don't do it then. Let me
Okay.
see if I can. It's still saying no internet. All right. Well,
Should we take a break?
yeah, I will call you when it's back up
Okay,
and we'll finish that one. I mean, literally, we have 2 minutes left.
okay,
All right, I'll call you back in a few minutes.
okay, hon. Bye-bye.
Okay.